Hi, I'm John Burroughs, President and CEO of the Burroughs Healthcare Consulting Network, and I'd like to talk to you briefly today about managing aging and other potential impairments on your medical staff. This is incredibly difficult to do because impairments are something we really don't want to face. Why? Because we'll all be eventually impaired at some point or another, and we wouldn't want anyone to take action against ourselves. But we must do this because, frankly, when we turn our backs on an impaired practitioner, we turn our backs on them as individuals. And it's not the right thing to do, and it can inadvertently cause harm to the patients we serve. So here's a four-step approach to consider. Number one, physicians should discuss your current approach to potential impairments. Are we turning our back on people with potential impairments, or are we reaching out and helping them? That's probably the most collegial thing we could possibly do on a medical staff. Number two, review the scientific correlation between aging and undiagnosed impairments. It's a known fact that when we get to 65 or 70 years of age, the incidence of undiagnosed impairments goes up significantly. There's ample data to back that up. You should share that data with your medical staff. Number three, develop a policy and procedure around the aging practitioner. A typical approach would be when a practitioner reaches the age of 70 or so. You shorten the reappointment cycle from 2 years to 1 year and ask for a fitness for work evaluation. Fitness for work evaluation is not a physical exam, it's a vocational exam that asks the question, does the physician have any cognitive, psychological, physical issues that would preclude them from safely exercising their requested clinical privileges? If there is, you can work with the physician so that they can voluntarily modify their privileges so that you don't have to take any corrective action, and you certainly don't have to report anything to the National Practitioner Data Bank. Number four, demonstrate that the impact of having an approach like this is to protect both practitioners and patients and to optimally extend a physician's professional practice and career. When you identify a potential impairment for a physician and work with them to voluntarily modify their privileges, you actually enhance and promote their professional career, not detract from it. By allowing a physician to fail and inadvertently cause a patient harm, you may short-circuit a physician's career and cause damage to their reputation, which could be irreconcilable.